Hello everyone.
We don't see many of the journalists coming together, not even in the same cities. It is very difficult, as a matter of fact, that because we are kind of working largely from home. At times we are on ground covering stuff, and we all know now in South Asia how difficult it is to cover this, which we have not seen before. None of us across the world, across South Asia, in our own cities, we have not seen anything even close to this. So this is kind of bringing out newer experiences, tragedies and traumas as well, because we have lost some of our colleagues here in Calcutta. I have lost some of my friends and journalists across the world. So it's been traumatic, but as in journalism, that we know that exciting moments are always there when you cover something. Human interest stories come out, so we would expect you to narrate both, give an idea about the country that you represent, well, not just the country but your own personal experience as well, which perhaps goes beyond one's own country. And so altogether, give us an overview. You all are journalists, you know how to deal with it. So as Riaz has said, that you speak please for 10 to 12 minutes, and after which it will automatically I'll pass it to the next person, because we will not go into, in some webinars people try to bring in a wrap up for 1 minute 30 seconds. I won't do that. I'll just move to the next person, the list that is, and then follow the list that has been given to me. The first name that I can see is Noor Shafaq. He has been a journalist, a presenter, a drama writer, a producer, for quite 11 years. Now he is working with the BBC Afghan service. In fact, Afghan service has been hit by COVID. One of my very good friends, Syed Anwar, he, I think, was affected, and now he's back to work, and that's great news. So he's a great journalist. And then he also files for BBC Hindi and BBC Urdu, and he also writes poems, short stories, and articles. So maybe there's some kind of a poem coming on this, COVID, we don't know these times. So he's going to tell us more about it. So over to Noor Shafaq. You can hear me?
Yeah. I'm
great.
hearing you, and hi to everyone. I'm happy to be a part of this conversation. So to the point, I will start from how the coronavirus came to Afghanistan. Coronavirus first positive case was found in Herat, the western province of Afghanistan, which is actually door to Iran. And due to the Ministry of Health of Afghanistan, all the first positive cases were found in those Afghans who were returned back from the Qum city of Iran. Qum city was actually the city where positive cases were very high in Iran. So those people were returned back from that city to Afghanistan, and that was the method that they brought coronavirus to Afghanistan. And the first case was found in the last days of February 2020. If I start when the coronavirus came to Afghanistan, what happened? The first thing, like in the start, the pandemic was like unknown to everyone. So Ministry of Health of Afghanistan, Presidential House and Security Section warned people to take care of themselves, use masks like other countries, use gloves, wash their hands, and keep in mind the social distance, and in all take the pandemic seriously. But as people were unknown to them, to the pandemic, so they were very careless. As you know that most Afghans are very religious, so they were saying that death and life is up to God, and if he wants, we can live long, but if he doesn't want, so we cannot protect ourselves with these gloves and masks. In first days, when I was talking to the people, I will tell the story in Hindi. So जब मैंने लोगों के साथ बात की, वो कोई भी
I'm not. Sorry to stop you. I mean, everybody understands Hindi here. I mean, everybody understands Hindi.
It's story. Yeah.
Hello. Yeah. I don't think everybody understands Hindi here, which is a problem. Could be a problem. Anyway, you can go ahead.
Shafaq, you can continue in English maybe, because some people are from Sri Lanka and Bangladesh, and Nepal also.
Yeah.
Okay.
Okay.
Okay. So in the first days when I was talking to the people that why you are not using mask and gloves, their answer was that it's up to God. And once when I was talking to an old person at Kabul, that doctors are saying mostly the people who are in danger, they are aged people, like old people. So why you are not covering your face? So he make some fun and he hugged me that come on, it's not true, and I am very strong and nothing will happen. So that's why the people was not taking it seriously in the first days. But when the death tolls increased and the government pressurized the public, police closed the hotel, banned Kabul, people took it a bit seriously. But nowadays, you cannot feel if there is any pandemic exists in Afghanistan. All people are going to parties, and even the wedding halls are open. Just schools and universities are remain closed. Other activities are now like normal. And the second thing, like as you know, Afghan people are, when they have any health problem, they go to India, Turkey, Pakistan, etc. So the first challenge for our people was the treatment. And in Afghanistan, there was just one treatment center that was in capital Kabul here, named Afghan Japan. And the problem was that in those days, most of positive cases were in Herat province. So Herat is far from Kabul. The problem was that it was taking too much time to bring samples to Kabul, Afghan Japan hospital and then test it. Because that center had not that much capacity to handle it. So the government made some new centers to deal with it, but there was a serious issue, like I said, testing of samples. And I cover a story of Dr. Yusuf. He was a doctor, and he died because of coronavirus. So when he died, in his janaza, the result of his sample came out that he has coronavirus. So after some 2-3 days, his 3 members of family, his one sister and one brother also died because of coronavirus. And almost 40 members of their family were affected. In Afghanistan, it's a problem that all live in one home, like we have a big family, so that was also an issue. There was lack of masks, gloves, sanitizer, oxygen balloons, and it was very difficult to find even in high price. And also ventilator was also not here in Afghanistan, and some countries then help Afghanistan. but a bit later. So people are still hesitating to go to hospitals, and they are worried about coronavirus. Even if they have a very simple illness, they are not happy to go to the doctor. And in Afghanistan, it also happened that some people use some homeopathic medicine. And there was a Hakim named Hakim Al-Khuzai. He was a bit against the Ministry of Health. He produced one kind of medicine, but Ministry of Health rejected it, and they were saying that it has a combination or a mixture of opium, so it is not good to be used. So it was also a very funny story between Hakim Al-Khuzai and Ministry of Health. And in these all, many of countries and organizations help Afghanistan, like World Bank announced some 400 million, but due to Ministry of Health, they have found just 20 million of it. Asian Development Bank and Germany, USA, many other countries also helped Afghanistan in this case. And China, UAE, Turkey, Iran, and India, they also help Afghanistan in some medical stuff and some food stuff. So that was the health matter. And in overall, if I say, still when I am talking to you, due to the numbers of Ministry of Health of Afghanistan, in all the country, we have more than 35,000 cases, positive cases, with 1,164 deaths. And more than 23,000 people are recovered from the pandemic, and virus. And the active cases are more than 10,000. The more affected province in Afghanistan because of the pandemic is Kabul, the capital, and it has more than 40,000 positive cases with 448 deaths. Herat, the main starting place of the virus in Afghanistan, is in second place with more than 5,000 positive cases and 155 dead. And fortunately, the less affected province is positive cases with no deaths. So I think the time is less. In last, I will say a little bit about some corruption. Yes, there was many allegations of corruption in Corona Fund, even though it is not proven yet, and President Ghani has ordered to investigate the claims, but the results are still not clear. It's not come out yet. Some news agencies have claimed that numbers of officials have bought some needed medical stuff 2 to 3 times in high prices compared to its normal rate. And due to Pashwak news agency, that is the well-known news agency in Afghanistan, due to them, some medical officials have smuggled around 32 ventilators to Pakistan. Even though the Ministry of Public Health of Afghanistan has rejected the claim. But as I said, the President has ordered to investigate the allegation, but the results are still not clear. So we don't know is there any progress in the investigation or not up to now. And some other claims are also have been made, but it will take time. So in the last, is the pandemic affected the peace deal with Taliban or not? I can say that Corona pandemic was a very good excuse for the Afghan government to release Taliban prisoners, because if there were no Corona, it would be difficult to release them that simply. Before the pandemic, Afghan government was saying that the Doha peace deal is signed between Taliban and America. We are not part of it. But the pandemic changed decisions. And in the start of the pandemic, Afghan government released some other prisoners too, saying it will help to decrease the positive cases. And I think that was just an excuse for goodwill. And in my point of view, the government was trying to do that because when they released the Taliban due to Doha peace deal between America and Taliban, the public relation will be a bit soft. And now it seems like that. So yes, now more than 4,000 Taliban prisoners have released, and that was the main condition of Taliban and the way of starting the intra-Afghan task, which the hopes are will lead Afghanistan to the peace after around.
Shafaq, if you can wrap up now.
Yeah.
I mean, sorry, if you can wrap up in a minute. Yeah. In a minute.
Yeah, it's finished. So let's see what happens next.
Right. Thank you very much. I have plenty of questions for you, but we will hold it for now and move to the next person in the panel. Next person in the panel, the list that I have is Sumaira Khan from Islamabad, Pakistan. And she has been working for about 16 years, investigative reporter, documentary producer, with an English language news channel, with the Indus News, which is of course very famous in Pakistan, and also seen in some parts in India as well. I think rest of South Asia. Indus News World is a senior correspondent based in Islamabad and covers stories with humanitarian perspective and climate change particularly. She has also frequently appeared on BBC Arab and Al Jazeera Arab/English, and also is an analyst from Pakistan. So with that, over to Sumaira. We would, as we have discussed before, that we are going to talk about South Asia and one's personal experiences as far as covering of this pandemic is concerned, which has been getting bigger and bigger. And one good news, I mean, we already have many people joining us, and many people want to ask questions as well, I guess. I mean, yesterday I was watching a webinar by the Economist editor, Zeni Manton Bedoz, and after the first few minutes, they only have had very few, I think 3 or 4 persons willing to ask questions, and now we have much more than that. So at this stage, I think we are in some way ahead of the Economist as far as questions and the people willing to ask questions is concerned. So over to Sumaira.
Hi, this is Sumaira from Islamabad, and most of the majority, I think the major chunk of my introduction, you have covered it already. So it's a very warm welcome from my side as well, all the participants abroad. And right now, whom I'm talking to, whom I'm addressing, and those who can listen to me, who can hear me, and those who can see me. Assalamu alaikum from my side to everyone out there. And obviously, I'm here to share my experience. And let's begin with the beginning first. First thing first is when Pakistan came across COVID-19. Pakistan's response to COVID-19 was, I won't say that it was so energetic and so rushed thing. In fact, I would say that I must confess one thing, that in the beginning, back in November, when this virus originated from China, and China, as we all know, it's our neighboring country. I think just a few 100 miles from my capital city, Islamabad. If I go through Punjab, there it is, the south border of China. And you're well aware of that this particular point is very famous from the trade point of view, that many convoys go from this side, and many we receive from Chinese side. So that was one main entry point that could have been tackled very well at that time. But since we were so relaxed that no, it's just Wuhan city, and it will be, since China is very good at tackling and controlling all the dangers, and don't take me wrong over there, I'm not including any other aspects of war and any other thing in there, but speaking about virus completely right now. So we were at an ease that yes, China is taking good care of its own virus, and we should be relaxed and so chill, everyone. So I think that was a little reaction from my side, for my government, that why not? Even what if China doesn't control the virus in the ways we are expecting it to be, and what if it travels to other parts of the world? And eventually it happened. So my first interaction with Prime Minister of Pakistan, Imran Khan, was back in it was, guys, I guess it was end of January. And again, there was another interaction when I took up this matter with him, that what is our preparedness level if this virus travels to Pakistan. And obviously, I'm not responsible for any other country, but yes, if I'm responsible for the well-being of the entire globe, so I'm thinking like charity begins at home. So I'm thinking first of all, I've started thinking about my home. So Prime Minister Imran Khan at that meeting, when there was no COVID at all in the interactions, there was no measures being taken to curb on that. So Prime Minister said that, okay, yes, we are very well aware of that. We have all the accounts regarding this virus. We are gathering news about it. We are gathering information, and we have there is an institution, there is a department that we call National Disaster Management. So we have alert, we already have, we have sent instructions to that department to stay on its feet, and they should be ready to tackle any situation. And exactly that happened. Whoever can hear me right now, my respected colleagues, that in mid March, when we were at a grave risk, we were at a great danger, because we were not just afraid of this virus coming from China. We had four very active borders for Pakistan. It's India, it's China, it's Iran, obviously, and Afghanistan. We were worried about Afghanistan and China mainly. Why? But our expectations totally, not totally, but I think the major chunk of our expectation went a little wrong. Our calculations were a little wrong, because we did not pay heed to Iranian border, where we had sent around 7,500 pilgrims to Iran for their, obviously, their holy, to just to have that yatra and pilgrimage. And we did not have that aspect in our mind. We were totally paying heed to China and Afghanistan. We had closed down our borders with Afghanistan and China. And eventually, in the first phase, China, in collaboration with Pakistani government, requested government of Pakistan not to get their students out of Wuhan city in particular, and from the whole China in general. So that was a major issue in Pakistan, because the parents were quite they came up with resentment. They had protested against government. And even though at that time the media in Pakistan, it supported the parents in that regard, because the kids were going through a little horrible stage, because that was an initial stage for Chinese city Wuhan as well. They were trying to meet all the demands of their own resident, their own citizens. So they had an extra and added burden of our students as well in the universities, lockdown in their universities. So these were the things, these were the setbacks that were going on for Pakistan. But with the passage of time, I think Pakistan, through a single platform in March, it was NDMA which took up the matter. I think it was. I must appreciate them that in terms of testing facilities, in terms of hospitalizations, in terms of ventilators, and in terms of oxygenatings. I think these were main challenges for us. And to implement the SOPs, implementing the SOPs was another issue with the Pakistani community, where they were not ready to believe in this coronavirus saga. They were terming it a controversial theory, and there were different stories and fairy tales that it must be a Zionist move against Muslims. One, which was very unfortunate. I was totally shocked on having this account from coming from different sects of Muslim community, and we tried our best. We tried our. I think we tried our hardest it was one of the most difficult times for me as a journalist to convey to my community that yes, it's a reality, yes, it's a disease, yes, it's cureless. The only thing we can do is to take care of ourselves and to implement the SOPs being rendered by the authorities time and again. Then we established, the government of Pakistan established another dedicated wing to control the pandemic and to monitor the entire situation, and that was NCOC. It was National Coordination Committee, which was responsible to collect all the data, to further it with the trickle down effect, to further explicit it in amongst the masses without any exaggeration and without any hype. So people should not get scared of this pandemic, but they should learn how to live with this new normal. So bringing this new normal into and implementing into the community, that was my first challenge as a journalist. I hope I did my best, and my colleagues here in Pakistan did their best. But the authorities in Pakistan, as you might know, if I give you fresh data of today, then you can see that the total active cases, COVID cases, have reduced to 57,000 from 70,000. It was 70,000 day before yesterday, then it was 60,000, and today it's 57,000. And 47 people have lost their lives in past 24 hours. So bringing it from hundreds, it's now 47. So the authority, indeed, they deserve an applause in that regard. And if I compare that data with normal deaths, when you see across the country, Pakistan and India, according to my point of view, given their poverty levels, given their economic challenges, and given the scenarios, I would definitely here, I think this is the right time to speak about that. That given the scenarios, we are facing war threats from each other. We are in different conflicts with each other, and in those times when we are not just faced with one COVID, we are faced with locust threat as well. Yesterday I made a report on locust threat that is coming to Pakistan and India in coming 2 weeks from the Horns of Africa. That is another problem for us, which is because they are just wiping out our vegetation. So in the times of these, and now we are faced with monsoon as well. So you can just imagine that what kind of dilemma Pakistan and India, these both countries, are in. So I must appreciate our countries for taking every possible measure in this regard. And even I criticized my Prime Minister's decision when he announced prior to Eid al-Fitr a month and a half ago, that he announced that a smart lockdown will be implemented, and we are not in a position just to avoid an economy crunch in the country. He allowed all the markets and all the bazaars to reopen their businesses as usual, but with few SOPs and strict measures on them by the authorities. So if I talk about Pakistan right now, I think the smart lockdown is going well. And now Pakistan is in a phase after 2 months. I think it's just a very little span of time where Pakistan has survived from black marketing of an ordinary mask in the markets, where the pharmaceutical mafias, they all of a sudden they disappeared all ordinary masks. We are not even talking about KN95 and N95 masks right now, but imagine when your pharmaceutical mafia wipes out even an ordinary mask from the markets and the medical stores, what would be the condition for the government and the other regulatory authorities and bodies to fight this pandemic? But I think there was 24/7 and 24 hours a day work plan given by the government to other authorities to immediately catch those hoarders and punish them for this black marketing thing. And then there was another aspect that I must appreciate, that I think there should be a strict crackdown instead of a smart lockdown or a complete lockdown. Our government should get down to curb on these mafias. Either it's a pharmaceutical mafia, either it's any other engineering mafia. Because when it came to making these ventilators and oxygenating the patients, I think that was the deadliest time I have ever seen. That people all of a sudden they went for this price hike, and the mask I could buy in 25 Pakistani rupees in January or February. I bought it for my kids because my kids are asthmatic as well, and I have to take a very special care of them during this pandemic. And I did not buy a mask for me when it was not available, but I had to literally plead to the general store salesman that please give me at least a pair of masks for my kids. They are asthmatic and I need that for them. So even I was prone to COVID-19, and I think the kind of work
You have about a minute to, sorry. You have about a minute to wrap up. Yeah. Please go ahead.
Okay.
Yeah.
Now with these fresh coming data from the across Pakistan, I think all four provinces, Gilgit-Baltistan, Azad Jammu and Kashmir, they are doing fine according to the data right now I have in front of me by July 18, and hopefully it's going down. And I talked to the authorities just prior to speaking to you. I spoke to the authorities of NCOC, NDMA, and all the PDMAs in provinces as well, and they are very optimistic right now, Riaz, that we'll be able, hopefully, inshallah, we'll be able to announce by late August that yes, we can now claim that Pakistan is corona-free, and if not completely corona-free, but yes, partially, and majority of the area can be claimed as corona-free. So we are just keeping our fingers crossed, and we are there to report each and every moment to you. Whenever you need us to report anything from Pakistan, I'm here to serve you all. Thank you so much.
Right. Thank you so much. Thank you so much, Sumaira. Thank you so much.
Just
you can hear me, right?
Just a correction, because some people joined late. I'm Riaz. I'm not chairing the session. Suvojit Bagchi is chairing the session. Thank you.
Right.
Thank you so much. Thank you much.
Yes. Now we have the next speaker, who is from India. Interestingly, what is happening now in Afghanistan and Pakistan is the curve is coming down, whereas in India it is going up, which is what the difference that we can see on a day-to-day scale. Well, we have Niha Masih. I can't see her on screen. Riaz is she here? Is she around? Hello, I can't see her. Niha, are you around?
Yes.
Great. So we have the next speaker, Niha Masih, with us. She's the India correspondent for the Washington Post. She's based out of Delhi, and before joining the Post in 2019, she reported on politics, conflict, and religious fundamentalism in India for Hindustan Times, the newspaper, and New Delhi Television, now which is NDTV. Now she's a graduate. She's a graduate of the Columbia Graduate School of Journalism, and she's our next speaker. Over to you, Niha.
Thank you so much for having me. Can you see my video? I thought I was on.
Okay, not on my screen anyway. I think I'm a little confused, but please go ahead. Not a problem.
Okay, great. Right. So I think maybe I could sort of start by placing in context where we stand right now. And as you were saying, that in India the curve is rising, but that's happening in many countries across the world. So crossed about 1 million cases, and we are the third worst hit country in the world, behind United States and Brazil. And there have been some very specific things that India has done differently from a lot of the Western countries, which saw the initial spike in COVID cases, unlike India, where things started picking up slightly later. So the one big thing that stands out in India's response has been the early lockdown. That's been the definitive sort of feature of our strategy to combat the pandemic. and we went in for a very strict and a very early lockdown at a time when we did not have enough, when we did not have a huge say, and it was, and I think that the government has often touted as like a sort of success story, but we have to kind of place it in context, because it definitely did help in reducing the rate of infection at that particular time. And it very, very importantly gave time to the agencies, to states, to hospitals to ramp up our crumbling health infrastructure, which was absolutely unprepared to deal with a pandemic of this nature, of this kind, that has swept across like developed countries as well. So in India, that situation was much, much grave. However, that lockdown also created a humanitarian crisis, which I will come to slightly later, and that kind of created its own monster. But sticking to the pandemic, I want to also highlight right now that India's spending in healthcare and infrastructure is so poor that it was, and it still remains a huge challenge. We spend just about 1% of our GDP on healthcare, which is lower than the global average. So at the start of the pandemic, we did not even have 1 bed per 1,000 people. We had 0.5 beds for 1,000 people, which is very, very low. And as we have seen at this time, this is a disease that requires early treatment, isolation. So this is not something that can be done without adequate infrastructure. Italy, for instance, had 3 beds per 1,000 people at the start of the pandemic. South Korea had 12 beds per 1,000 people. So India was very, very low on that. Of course, there were exceptions, which are like states like Kerala, which have a very, very strong health infrastructure, as well as primary healthcare system that was useful, and I can again come to that later. So these were sort of some of the things that we have to place in context when we talk about India. It's hard to really compare two countries at a time like this, even within the region, and I would refrain from doing that. It's impossible to compare India to Pakistan, given the population difference. It's impossible to compare India to Europe, given India is kind of like a big continent in its own self. But I do want to sort of, again, point to one of the things that our government has been citing through this time, that while our cases have been rising, the number of deaths have remained relatively low. Again, when you compare to the US or Brazil, which are ahead of us, at a time when they had about 1 million cases, the number of deaths reported in both those countries were much higher. In India, we had about 27,000, and they were at like 45,000. So while that is correct, it is again important to look at it in a slightly more nuanced way. Why is it that we have had lower deaths? Medically, I don't have like an answer. The doctors and experts are still studying what is it that could lead to some of these things, and some of those aspects include having a younger population. Whereas we have seen in the Western countries, the older people have been more susceptible to dying from COVID as opposed to younger people. So perhaps that's one factor. There is also talk about like having a different strain of virus in different countries, which reacts differently. But all of those are like things that are still being analyzed and studied. So it's hard to really say what is causing that. But what we have to keep in mind is, while our overall numbers may seem low, we are also testing less. So our testing numbers per million is also lesser than the US and Brazil. And most importantly, and this is sort of a story that just sort of came out today, which we reported on, was the challenge of data in India. In normal circumstances, 20% of deaths remain or go unrecorded or unreported for various reasons. And imagine that at a time of a pandemic. So there is absolutely no clarity on, or no reliable information that we have nationwide on how many people have died due to COVID. Now, again, there are various things here. Some people could have not been tested, and have died without having too many symptoms of COVID. That's one categorization of people that could have gone missing. There are also reports of underreporting by hospitals. So, for instance, in the city of Baroda in Gujarat, the official statistic for deaths is 60. In all of month of June, the figure was 57, and on 1st of July, they reconciled it and said 60. So, since the beginning of the pandemic, Baroda claims to have had 60 deaths. I spoke to a hospital in Baroda where I was told that that one particular hospital has recorded 100 deaths so far. So if you see the scale of underreporting, again, very hard to say. So there is, of course, underreporting. And third is the figure of excess deaths. How many deaths have happened how many deaths normally happened in the period, and how many deaths have happened in this period, which is also a tactic that the Western countries have used to identify suspected COVID cases that may have gone unchecked. Again, that data is so hard to find in India. We approached 4 cities, Delhi, Bombay, Chennai, and Calcutta for that figure from last year, from March to June, and from this year, March to June. And only Bombay provided us full, complete month-wise data. And so interestingly, what we found was that March, April figures were sort of similar. However, in May, there was a huge difference, nearly like 5,000 difference of deaths. So nearly 13,000 people died in Bombay in May, while in last year, May, that figure was just under 7,000. And that gap is not covered by the COVID deaths, because COVID deaths in Bombay have only been about 2,000 in the month of May. So where are those excess deaths coming from? Were they COVID cases that went unreported? Were they people who were not able to access healthcare because of COVID? So lots of those questions. So I would say that data has been a big challenge in India, and it's always been, and it's more acute at a time like this. And so for the government to say that we have been successful in containing deaths has to be taken with a pinch of salt, and many questions. In terms of challenges in reporting at a time like this, I think besides the obvious ones of not being able to easily go out on the field and do reporting as we are used to earlier is of course a challenge, not just because of safety concerns right now, but also because of travel restrictions that keep changing, and especially again during India's lockdown, where it was impossible to fly to Kerala, for instance, or wherever else. So that's of course been a challenge, which means that we have to rely on our sources on the phone without necessarily being able to be present and counter what we would ordinarily do. But that is also linked a lot to the transparency that agencies and governments don't allow for. India has again notoriously been bad on the transparency front. And at a time like this, one would imagine that there should be more transparency for more awareness, and also for making the public more informed, or keeping the public more informed, which could actually help in slowing the spread. But it's actually been the opposite. So Health Ministry, for instance, used to have daily briefings at the beginning of the pandemic, and in the past months, they have been reduced to like once a month affairs. Very few journalists are allowed inside those briefings, government certified PIB card holders only. And even amongst that small subset, in the last briefing, one of the journalists who was present there tweeted how very few questions were taken. And then when the journalist protested saying we have more questions, they said, you come up to us later after the conference and ask us directly. What does that mean? That means that information or the questions that those journalists had will never be in the public domain, because a press conference is telecast live on television, or you can watch it on YouTube, accessible to everyone. But when you shut that down and say to journalists that you come to me directly and ask me, that information is necessarily only then between the journalist and the source. So these answers are not known to the viewers. And besides again, like, government officers not responding routinely, I'm sure the beat reporters will have a better track record than someone like me, for instance, where I've often had to chase government officials for a response and have not gotten that, and that's really not something that should be the norm at a time like this. So all of those are, of course, big challenges that we have seen as journalists. I want to kind of come back also to the migrant crisis, which I briefly mentioned earlier, that while one of the strategies that India went in for, which gave time for the agencies to ramp up their infrastructure, it also created a huge humanitarian crisis. So we may have definitely managed to save some lives, but we definitely took away the livelihoods of millions of people. And that's not something that can be, that can go away quickly. That is going to be the aftershocks of that decision will be felt for a long time to come, and we can see it still, even though it's not in the news anymore. So for me, the defining factor of that crisis was the short-sightedness with which the government treated it as it was unfolding. So it is absolutely likely that you take a decision in good faith, which has unintended consequences, though this is not something that should not have been factored in. Even if we say that they took the decision in the interest of the country at that time, and that is fair. But when you see the scale of what was starting to happen, people walking on foot from Maharashtra to Chhattisgarh, from Delhi to Jharkhand, these are like absolutely crazy situations. And as someone I had interviewed described it, saying not since the partition has such a large mass movement happened on foot. And it is not a subset of a population. It is a very, very large set of population that was forced to do this because, and even when that was happening, for weeks on end, no arrangements were made to transport them back. No provisions were made to make them stay. All the states were found scrambling. The center was found scrambling. All of that was ultimately, the people were left to their own fates in a way. And as we saw, there were accidents. There were people who died while walking. There were very, very tragic stories that came out of that. So I think to not have factored that in will be a defining feature of our response to the pandemic, even though it is not directly related, to the numbers that we are now seeing, and we should definitely not overlook this aspect while we talk about how India's fared through this time. And I think that's definitely something that was noted in the international press as well. We wrote several stories on how this has become a possible choice for the migrant workers to stay in the cities that without an income, or to brave the which can actually kill them. Yeah, so that's definitely one of the things that stands out. But I think what we have done better than many other countries, and here again, I would like to point to the US and Brazil, is that the government did not shy away from, minimizing the pandemic, as it were, early on. Which I think has been useful in making a large section, I won't say everyone, but a large section of the population not take it lightly. I mean, there are still reports that we see of people not adhering to social distancing, or not wearing masks, or not following directions, but I don't think that the government here did not take it seriously, unlike in Brazil, where the president takes off his mask after he tested positive, or in the US, where the ruling class has been actively, fighting the epidemiologists in the country who are asking for people to wear masks. So I think in that sense, we definitely did not, do that, which could potentially have created a lot more problems for us. And I think the journalists, local media have a big role in bringing out some of the infirmities that we faced, whether it was hospital beds that were running out, whether it was the lack of availability of masks, the healthcare workers were facing inside
Niha, I'm sorry,
hospitals.
you have about a minute to wrap up. Yeah, about a minute. Yeah.
So I think some of those concerns were journalists were able to bring that out to good effect, and that's been again very helpful in holding different states to account. And I think here I would also like to point out that this whole time also brings us to a very important point that often gets overlooked in our country, which is the federal structure, which has really shown on how state governments ultimately are so much more important than we often give them, and so many of the states have shown tremendous work, have put in a lot of effort. Without we would be in much worse and again, a case in point being Kerala or even Bombay, where things seem to be back in check. So yeah, I think real for now.
Thank you, Niha. I mean, thank you very much. That's very informative, and particularly the whole challenge of this data which is not coming out, or as of now we are not. This politics of data between the state and the center. Every political party trying to perhaps suppress some of the data. There's a competitive data suppression going on, which also I find very fascinating, particularly from the east when we look at the center, which is very complex. And we'll go more detail into that, perhaps during question answer. Our next speaker is Phanindra. Phanindra is my ex-colleague from the BBC, and he has been a broadcast journalist with BBC-Nepali service based out of Kathmandu. He covers political and social affairs, focusing on accountability and governance. And recently, he has looked into the impact of COVID-19 in Nepal and efforts by the government and donor agencies to deal with the pandemic. He was a Hubert H. Humphrey Fellow at Arizona's Walter Cronkite School of Journalism and Communication in the US in 2018-19, where he studied data journalism and public policy, among other things. Over the past decade, he has covered the UN General Assembly, the New York, and also produced in-depth stories on Nepal's peace process, national security, and Nepal's UN peacekeepers abroad, among others. So over to you, Phanindra.
Are my own, and it doesn't represent to the organization that I work for. I'll be mainly focusing on the situation of COVID-19 in Nepal, national response and challenges, and how the media is covering the pandemic, and also how the media is impacted by COVID-19. As of now, Nepal has total tests of over 300,000, and positive cases are 17,502. The curve is actually declining in the last few days, but however, it also appears that the number of tests are also declining. There was a headline in the Nepali Times last week that stated that we are being tested because the number of tests are low, and until and unless the number of tests are up, it is very difficult to actually measure the state of the situation. Nepal says of the 17,502 positive cases of COVID-19, nearly 65% of people have recovered and returned back to their home. And they say that they claim that the figure is good, decent, because nearly 10,000 in every 1 million Nepalese are being tested currently. But things are not under control as it appears, because we reported a lot of challenges regarding management of quarantine centers, administration of tests, and even effectiveness of lab, because the test conducted in 2 labs that showed 100% of COVID-19 cases positive. So how does that happen? All the tests that were conducted could be positive. And first case of COVID-19 in Nepal was reported on January 23rd, when a man from Wuhan returned to Nepal. But the next case was reported only in March. And then, like when India imposed lockdown, around the same time Nepal imposed lockdown, and then it played a crucial role in controlling the spread of pandemic. But as Niha mentioned, there were not proper preparedness or effort to uplift the capability of health infrastructures. And also, Nepal faced another kind of challenge which it never imagined, because Nepal sealed the border with India and China, and there was a huge wave of migrant workers that took long journey across cities in India to come to their homeland. So the government was not actually prepared on how to deal with them. In that situation, those people crossed the river, or there is no, like Nepal and India share open borders, so people could move around. And then new cases of COVID-19 emerged. Some of the districts along the southern plain, which border with India, they became hotspot of COVID-19 cases. In the meantime, when India saw this Tablighi Jamaat and some Jamaatis in Nepal were also blamed or stereotyped, saying that they brought COVID-19 cases from India. But when we looked into the topic in detail and investigated the matter, it was revealed that they had not, they came to Nepal much earlier than the gathering took place in India. And there were those type of misinformation emerged, and it is also like difficult during this time to gather information, because the government still organizes daily press conferences, but reporters are not allowed to get in there, and they don't take questions. It is a one-sided update of the number and cases. And there were like, because there were many questions on, what is the government doing to enhance health infrastructures and things like that. It was really very hard for journalists to get at times the official response from government on the topic. Before the COVID-19 pandemic started, Nepal just had one national laboratory where the test could be performed, but now it has been expanded, and we have 27 labs that could conduct the tests. And still the number of ICU beds and ventilators are very low. Nepal has over 30 million population, but we have around 800 ventilators and around 3,000 ICU beds, which is very low. And the government, in the meantime, when they imposed lockdown for nearly 3 months, they tried to buy medical supplies. But the procurement process got highly controversial, because there was allegations of corruption and political class was involved. It was not carried out in a very transparent manner, and they had to scrap it. And then later on, the Nepal army, the national army, was brought in to help this whole procurement process, and they decided to carry out the purchase of supplies of PPEs and all other essential kits, including masks and the other chemicals that are required for tests and the things that are required for laboratories. And it took months. So that purchase also is not free from controversy. Currently, the parliamentary committee is investigating the health minister, and it is also investigating the defense minister over the allegations of the graft over the purchase of medical supplies worth more than 2 billion. And as I mentioned, not only from India, Nepal also saw a huge wave of Nepal is likely to see a huge wave of migration from Middle East and other Gulf countries, because nearly 3.5 million Nepalese work in those countries. And it was really tough for the government to arrange the chartered flights. And so far, they have been able to rescue around 35,000 migrant workers. And it is expected that around 10 to 15% of the migrant workers will have to be will come, and there will be challenges to provide them employment, among others. So now I would like to talk a little bit about how media is covering the COVID-19 cases. As I said, most of the information is based on the updates, cases, and also lifeline information, and a lot of investigation on the purchase of essential medical kits and supplies. And local media is doing very extensive coverage, but because of the COVID-19, the newspaper have become thinner. Newspaper and all media outlets, private media outlets have lay off journalists, and according to the National Human Rights Commission, nearly 2,000 journalists have lost their jobs, which means like media as a watchdog is not completely being able to carry out its responsibility. I personally, I'm working from home, tracking into stories of the happenings. There have also been instances of spike in cases of gender-based violence, among others, that have happened during this time of pandemic. And there is a lot of concern over mental health, because there have been rise of cases of suicides. And also the journalists who are working on different media outlets, they have complained that there have been reduction in pay. The media owners are saying that the revenue have fallen up to 70%. And the situation is tough for journalists. And as we are covering this very important episode, in which we don't only cover the crisis, but also we are trying to help community to become resilient to this pandemic. It is really very difficult time. And there are also journalists are also trying to fact check some of the reporting by mainstream media. And there is apart from these things, when we have to be focused and united on covering the pandemic, Nepal has seen a host of issues with its relationship with India because of the controversy over maps and territorial claims. Lots of political maneuverings by the Chinese ambassador in Kathmandu. It has triggered responses in Delhi. There is a kind of stalemate in the ruling Nepal Communist Party. So sometimes this domestic political maneuvers and crisis has overshadowed the coverage of COVID-19 pandemic in Nepal. I think this is the point that I want to put at present.
Great, Phanindra. Thank you very, very much. I mean, you made a very important point, very, very important point, which is journalists losing job, including myself. Till last month, I had a job I don't have now. Now, well, we have got the industry sources reporting to me that Indian newspaper revenue is operating at a 30% level compared to what it was in 2019, this time of the year. That is completely unofficial. Friends telling me it is 30%. It's a drop of 7,000 crore in Indian currency at this point in time, and it may go up to 15,000 crore. So newspaper industry has been very badly hit in this country. So that is something which we're going to talk perhaps in more detail. Now we have our next speaker with us, and sorry to keep you waiting for a very long time. Zyma Islam. She's that's the Zyma Islam, right? That's the pronunciation, right? Zyma is from Daily Star, which is the leading English language newspaper in Bangladesh. Very well known. Graduate of Columbia Journalism School. She was an early childhood development reporting fellow between 2017 and 18. During the pandemic, she has been reporting on supply chains, labor rights, freedom of expression, and preparedness of hospitals. All very, very important issues across South Asia, across the world. So over to you, Zyma.
Thank you so much. Riaz Bhai, if you would kindly present my slides. I actually thought it might be easier for people to have the information on the screen rather than look at my face. Riaz Bhai? Is Riaz Bhai around? I'm sorry.
It's there on the screen. You can go on. It's starting.
Thank you so much. So a lot has been said about the how the pandemic played out in the subcontinent, and I think almost every negative thing that we've talked about in this webinar today, I can relate with. I can say that the same thing has happened in Bangladesh as well. But one of the most defining things about Bangladesh right now is that we are nowhere near the peak, and we are still, the number of cases are rising. We tipped at 2 lakh cases today, and the infection rate is currently, the daily infection rate is at 25%. And we've only tested about 0.5% of the population since March. So the testing is very, very low, but the infection rate is very, very high, which is why we can say that the infection rate, that the pandemic is really not even at the peak right now. We did have a lockdown in place, very similar to India, but the lockdown was withdrawn. It was put in place in April, and it was withdrawn by May 15th, citing business reasons. And things are, people are going about their lives, they're going to work, all the markets are open, all the mosques are open, people are congregating at mosques, every movie theaters are all open, social distancing is not really being maintained. It's been a complete disaster. So from March 1, we actually had our first case on March 3rd, and from March 3rd till June 1, we had around 50,000 cases, and from June 1 till July 17th, I made this presentation yesterday, we had around 150,000 cases. So you can see the trajectory over there. we don't know when the pandemic will start ebbing down in Bangladesh, because as long as the lockdown is not put in place, people are not going to be maintaining social distancing or taking any precautionary measures. So I just want to put that out of the way. I think this is the lockdown and the implications of the pandemic and the curve are something that we've talked about at length throughout the last 1.5 hours. I do want to sort of go into how
Zyma, are you there?
Hello.
Yes, hi. How much have you not heard?
So you were saying we have for
Yeah.
1.5 hour we were talking about pandemic, and you want to say something.
Okay, I'm so sorry. I have no idea how the mic got unmuted.
Yeah.
How the mic got muted. So I just wanted to say that for the last 1.5 hours, we've been talking about how the trajectory of the pandemic, but I think it might be more important for me to particularly talk about how the pandemic, what were the main issues during the pandemic in Bangladesh. So if you could go to the next slide, please, Riaz bhai.
Mm-hmm.
Yeah. At the beginning of the pandemic, very similar to India, our budgetary allocation for the health sector was less than 1% of our entire national budget. And the per capita spending on health was less than the price of a restaurant meal. So less than 300 taka. 300 taka would be around 250 or around 220 rupees. There are still entire districts in Bangladesh where which have only like 5 or 6 ICU beds in total. That is none of the government hospitals that were catering to coronavirus patients had central oxygen supplies. So you actually had in the hospitals that were catering to these patients, which ultimately present with symptoms of acute respiratory distress, you were dependent on oxygen cylinders. So the home cylinders that you would normally have at home, you'd have people reading those cylinders in, and it was an absolute disaster not having permanent oxygen supplies, central oxygen supplies in those hospitals. There was a lot of problem with giving doctors, nurses, healthcare workers adequate protection. I actually I lifted off a couple of sentences from one of my stories here. I said on a particular day at a public hospital, at the emergency ward of a public hospital, around 7 to 12 doctors were provided with 28 pieces of gloves, 10 masks, and half a bottle of hexazole. Hexazole is a kind of disinfectant. So it usually comes in bottles around this size, and they were given like half a bottle for disinfecting themselves and their tools and their gloves. This was for a 30-hour shift at one of the largest public hospitals in Dhaka, and they'd be seeing around like 200 to 250 patients. What happened is that very same day, very tragically, a coronavirus patient showed up at the hospital without any protection, infected literally the entire department in 48 hours, and they had to. It was a mess. This was in April, so it's not too long ago. But at the same time, this is what we were dealing with when the pandemic was already underway. I'm sorry, give me just a second. When the pandemic was already underway, we have better protection now, 3 months down the line. But at the same time, a lot of the protection has been crowdsourced and crowdfunded. So, for example, one of the hospitals recently installed a negative pressure chamber for their ICU, and this was entirely given as a private donation. So the public came forward to donate masks, donate protection. The government, while it did increase budgetary allocation since July, it was still not at the same. It's still, I mean, when you're at 1%, you can at best go to 2%. You can't go to 25%. That's not going to happen. So they increased the budgetary allocation by a little amount, but it was really not enough. If you could go to the next slide, yes. Yes. one of the biggest impacts of the pandemic has been on our export sector. So Bangladesh is an RMG reliant country and RMG export reliant country, and our RMG industry, sector has completely collapsed between I want to say between March and June. It collapsed in the sense that we had top buyers, like absolutely top famous brands canceling orders, putting orders on hold indefinitely. These include buyers like H&M. These include buyers like Primark. And as you can see on the screen, 1,931 brands and buyers canceled over 3.7 billion US dollars worth of products. That's that many factories affected, that many workers affected. So it had a huge impact on not only the export sector, but on the livelihoods of factories and livelihoods of workers. Workers went out of jobs. We still have not been able to come up with an estimate of how many workers, garments workers, are jobless because of certain. The government just doesn't have enough data on it. There are certain like legal complications to things like that, because if you say that you're terminating a worker, you'll have to give the worker certain benefits. Ultimately, what they do is they say that they're retrenching a worker, so they're going to give the worker an unpaid leave of about 2 months or about 4 months until orders come back in. So we still don't know exactly how many workers have been impacted, but we can easily say that it goes into the tens of thousands. Yes, I just want to point out that among the top countries that were canceling, as you could see in the previous map. Sorry, yes, would you go to the previous map again? Yes. Among the top countries that were canceling were the US and the UK. They each of them had had about like 700 or 400 brands each, and following that we had Sweden. You had Italy, you had France, Canada, even India canceled quite a lot of orders from Bangladesh. All right, if you would go to the next slide, please. Just as a continuation of that, these are 127 of the major brands that canceled contracts in various stages. Some of these products, when they canceled the orders, they were at the ports. They were at the ports in boxes, and the suppliers refused to receive them. Many of these brands had made public commitments to take these orders. They had said that they will not be letting down their workers. This pandemic must be fought together. But the reality was completely different. They would be, while they would be telling the world that they are taking orders, when it came to Bangladesh, and when it came to the ground, you saw that they're actually not taking the orders at all. They've put the orders on hold until next year, until next year, almost indefinitely. This included brands like Ralph Lauren, Bestseller, Kohl's. I'm guessing many of you are familiar with these brands. Right. If you would go into the next slide, please. Similar to the migrant crisis in India, we had an RMG worker crisis where a lockdown was put in place. So a large part of our population in the capital cities, in the urban areas, are workers in the export sector, and they're usually migrant workers. So they're coming from the villages and they come and live in the city, and then they're working in the surrounding factories. And very similar to the migrant worker crisis in India, what we had essentially was that these garments workers were, when a lockdown was put in place and their jobs were taken away, we had like hordes of garment workers walking back for miles and miles, walking for days at a stretch to reach their villages. And then all very suddenly, I think it was an overnight decision. It was almost an overnight decision. They were all called back in, and they walked back to the capital again. And it was not only was it a mess, but it was also a PR problem for the brands and the suppliers, because that aesthetic of garments workers walking miles to save their jobs is not a good one, and ultimately it reflects on the kind of responsibility that brands have been taking during this crisis. Riaz, if you could go to the next slide, please. Right. The next thing that I sort of want to talk about is the how journalists have been faring during this pandemic. I mean, we have similar sort of risks as everyone else, but the one thing that we did have that was very different from the rest of, I guess, the subcontinent is that we actually were not allowed to work. We have something called the Digital Security Act. It's a draconian law that says that you cannot tarnish the image of the country, or you cannot criticize. It essentially equates a criticism with treason in many ways. You cannot criticize the state, for example. And when it came to this pandemic, they used this law a lot against journalists. I think I don't have the very recent figures, but the figures that I have from a month ago was that a total of 148 people, 148 journalists and media professionals, professors, teachers, even students were arrested for either criticizing the government or writing statuses on or writing Facebook statuses or tweeting in any way, things in any way that critique the health sector. So this has been a major concern for us. When this always used to be in use, it's mostly, I guess it's always there like a hidden gun. They don't necessarily always use it, but they bring it out when they need to. So, for example, this was widely abused during our election, the year of our elections in 2018, and it's being widely misused here. So, journalists trying to report on corruption, for example, or journalists saying that the government is not taking our health sector seriously. People actually have been arrested for criticizing a minister who died. There were a total of 4 people, including 2 teachers, were arrested for criticizing a minister who passed away because of the sort of, I mean, they criticized the fact that the health sector is in shambles, and the minister who died was ultimately responsible for it, and they were arrested for just that. For just that offense. And this is non-bailable. So I can say something right now, and if someone thinks that this is in any way tarnishing the image of the country, I could be arrested, and I would not be eligible to apply for bail unless the High Court intervened or unless some judge deemed it necessary. So this ultimately had been like a defining factor of our coverage. If we had to rethink every single thing we wrote, we had to and I think our sort of the kind of rigor that we followed in the newsrooms had to be doubled, simply because of how much more prone we were to prosecution, arrests, arbitrary arrests, and just being locked up in jail if need be. I know I hadn't asked Riaz Bhai about like how long I would need to talk, so I didn't particularly prepare anything more. I might end it now, but I would be open for questions later on.
Great. Thank you very much. That's dot on time. And thank you very much for a very interesting presentation, and particularly certain things which you said, resonates in India as well, particularly this textile workers issue. In Tirupur, I was talking to somebody a few days back, and actually thousands, hundreds of thousands of workers there, textile industry workers there in southern India, they are without any work. They are locked in the rooms. They're not allowed to go back to their hometown because they may have to bring them back to workplace, which is an expensive affair. So the huge industry which is there, like Bangladesh, in parts of India, it's been hugely affected. And finally, it's the workers largely from Eastern India who are affected from Bihar, Jharkhand, from northeast of India, from West Bengal. These are the people who are locked in parts of southern India, parts of western India. So it's very similar to what you said in Bangladesh, what is happening now. We have our final speaker, and sorry to again keep you waiting for a very long time.
Okay.
I'm very sorry. I just, yeah. Yes, we have Zinara Rathnayake, and she's an independent journalist from Sri Lanka. We have really not heard much from Sri Lanka, so we are very keen to hear about Sri Lanka and what's happening there. She writes about travel, food, culture, community. Her work has appeared in BBC, the New Zealand Herald, Singapore Airlines, Atlas Obscura, and other outlets. She's also the co-founder and author of the travel and food blog Natn Zine. That's Natn Zine, right? Natn.
Yeah.
Great. So over to you. Please go ahead.
Yeah, thank you so much. So I think I'm really happy to be part of this discussion. So I'll start with the current situation of the country. So right now we have about 2,700 positive cases and 11 deaths. So I think in the region, Sri Lanka have been able to manage the situation pretty well. We actually did manage the initial stage, like in the initial stages, we were very fine. So for a few weeks of time, we did not have any positive case from the community. So all the cases that were being reported during the last few weeks were actually Sri Lankans coming back from abroad. So there were no community spread. But about 10 days ago, we reported a case inside the prison in Colombo. So right now we are having our second wave, and there have been a new cluster being formed with about 550 cases. So like this new second wave, we do not know the patient zero, the prisoner who got infected. We do not right now know how he got infected. So so following the current developments, actually, the general public is again very cautious, and there has been like certain fears about the community spread. So right now, actually, we do not have any kind of lockdown. The government opened schools 2 weeks ago, but they again closed the schools this week, and today they've been extended the school holidays as well. So, and right now Sri Lanka is preparing to go for a general election on 5th August, I'm sorry, and this election was twice delayed earlier this year. So the postal voting for the election was also conducted during the week that passed. So if I talk about, like, I think Sri Lanka in the region, apart from the Maldives, is like a very tourist, like the Maldives, Sri Lanka is also a very tourist-friendly country. So being a tourist-friendly country, how we manage the situation actually. If I talk about like when the world initially talked about the virus, when it was late December and early January, I was actually in India. I was traveling there. I had a couple of assignments in Guwahati, and then I came down to South, to Vizag, to Andhra Pradesh, and I then again went back. So during this time, actually, there was nothing in India, like no one talked about it. I met a lot of friends and then strangers on the trains, everywhere, no one talked about it. But my friends and family, they back home in Sri Lanka, they were very cautious. They were already talking about the virus. There was a panic being created, and they were buying masks and sanitizers and all those things. So following these developments in China and other Southeast Asian countries, the government actually instructed a quarantine unit to establish a quarantine unit at the airport. So after that, our first case in the country was actually a Chinese tourist from Hubei. So she was tested. She had been at the screening unit at the airport. She was screened and she had high fever. So she was treated and she recovered. So this happened on January 27th. And after that, the government actually asked the Sri Lankan army and the police to establish quarantine facilities and centers around the country. So what happened, then I flew back to Sri Lanka on 25th February. When I came down, I flew from Guwahati, Chennai to Colombo. And at any, in the Indian airports, there was no any kind of screening or no health checkups or no health inquiring about your health conditions or anything like that. But when I was boarding the flight to Colombo from Chennai, we were given health check forms. Every passenger had to state like our health conditions and our travel history and everything. So when I flew back, however, in the morning, there was no screening. And I was not contacted by the public health officers. But one of my friends who flew down from London on March 3, she was contacted. The public health officers visited her family and they inquired about her health and gathered information. So everyone who flew down, who came to the country after March, especially from high-risk areas, were contacted privately. The public health officers visited their houses and gathered information about their health conditions and how their well-being. So I think what helped us manage the situation very well was that, so after the January 27, the second patient, the first local national who was tested positive for COVID was reported on March 10th. So he was a tourist guide. So after this happened, the government suspended all the travel visas. So on March 11th. And after that, so then what happened was on March 20th, we went on a curfew, which was police managed curfew, and the civilian movements were severely restricted. And the other thing was there was no tolerance for social gatherings. So whoever was breaching these laws, the police and the legal authorities took actions, like legal actions against that. So this is something that really helped us manage the situation. At the same time, I think our public health sector, one thing that Sri Lanka has is, which is a positive thing, is that we have a state-funded universal healthcare system, which is completely free of charge. So our universal public healthcare system, the health infrastructure, is pretty strong, even under limited resources, and they have been very well praised even in the past, and they possess expertise in managing epidemics. So recently we've been able to be a malaria-free country as well. So like that, also they acted very efficiently in this time. And during the last government's time, there was a telehealth, the helpline being established in the country, which was called SOAS-ARIA, which is actually a pre-medical emergency unit, so people knew like where to call, how to call, who to contact, and all those things. And apart from that, the mass advertising was carried out on social media and then on television, radio, and all those channels. So about telling people how to, follow social distancing, and this is kind of a crisis situation. We need to do this. We need to wear masks, and we need to wash our hands. So people were always like told about these things. So there was they created a lot of awareness. So this is something positive, and these are the things that actually helped us manage the pandemic quite well. However, like while I told you that we've been doing it pretty well, the public actually criticized the government initially, because on January 27th, when we reported the first case, the tourist from China, after she was recovered, what the tourist board actually did was that they made a promotional video encouraging and inviting foreign travelers to visit the country. So while there is no logical proof that the virus dies in high temperatures, they stated that in the video that the novel coronavirus actually dies in Sri Lanka's hot tropical weather. It cannot exist, and Sri Lanka is COVID-free. So the general public have been very critical about this approach of the government. So they say that if we didn't if we didn't take such steps, we wouldn't have any kind of spread at all. So right now this is the situation. And while we have been managed the situation, the pandemic well, our economy has been massively affected. So one of the major sectors is the agriculture sector. So during the lockdown, the farmers could not sell their produce, so they had no income at all. And the other thing, I think, like Zyma told, the apparel sector, which is a big sector in Sri Lanka as well. And I think parts of India, Bangladesh, and Sri Lanka, we produce like one of the biggest brands, some of the world's biggest brands. And most people who work in these factories are actually women, young women. They work for long hours and under low pay. So the pay is very low, but they get something, and that is something for them. But during the lockdown, these factories were closed, their salaries were cut, and they didn't have any income either. So that is one thing. And if I talk about the other thing is tourism, obviously, that is a big part of our GDP. Tourism is completely suspended right now. There is absolutely nothing. So, however, tourism was actually hit way before the pandemic. We had the unfortunate event of Easter attacks last year in April, and tourism was badly hit after Easter attacks. And March 2020 recorded the 12th. It was the 12th consecutive month where we recorded like a negative growth in tourism. In December, however, in December 2019, it was kind of picking up, and we were kind of like almost there. We were back on the track because it was the peak season. A lot of travelers were coming. But however, in January and in February, the world was talking about the coronavirus. And a lot of travelers who come to Sri Lanka, they either go to Southeast Asian countries like Malaysia, Indonesia, Singapore, or Vietnam after they are traveling in Sri Lanka, or they come from those countries to Sri Lanka. So at that time, Southeast Asian countries and East Asian countries were like the hotbed for the virus. So this led to another kind of negative growth in tourism. And right now, there's no tourism absolutely whatsoever. So the sector that has been hardly hit is the informal tourism sector. So most of our tourism sector is informal, like the small homestay owners, the roadside vendors who are selling, groceries, street food, souvenirs, and then taxi drivers, tour guides. Those are the informal sector, and they have no income, little to no income, obviously. So during the lockdown that lasted, the government gave an allowance of 5,000 rupees to every low-income family, which 5,000 Sri Lankan rupees, which is about 2,000 Indian rupees, which is not much. I mean, it's not enough at all, but that was there during the lockdown, but not now. It's not. There's nothing like that. There's no allowance or income or anything. So the other thing is that so these are the industries, and that was being affected. Other things are like the tea industry, and so our export earnings fell by about, I think, 29%, and about like a great part of this is actually the apparel sector. So and if I talk about like the formal tourism sector, like the people in the hotels and people in great 5-star hotels and large resorts and all those things, like some people had massive salary cuts. And other than that, like some organizations, however, they've been managed to keep the employees' salary. They've been managed to pay it, but most of the times people have been massively affected. And the other thing so I'm a travel journalist, and I'm an independent journalist as well. So right now, I think travel journalists around the world have been massively affected by this, because to provide travel stories, we have to travel, and we cannot do it now. So I had like about 60% drop in my workload. Last month was like, there was absolutely like little to no assignments, because that was been like, we can't travel to write any travel stories. And I sort of like write a lot of airline magazines, and when airlines don't fly and they have been like, there is no magazine, and some of my stories have been, suspended because they do not fly anymore, and the magazine has been ceased publication. So this is something. And then the other thing in Sri Lanka was that, like India, Sri Lanka also kind of put the blame on the minority Muslims, about spreading the coronavirus. So what initially happened was, Sri Lanka originally agreed on burials, but amended the guidelines on April 11. So they made that the cremations of the COVID-19 victims mandatory, despite the WHO guidelines. So some individuals and some community, the groups from the Muslim community, they expressed dismay over this decision, saying that it deprives of their basic religious right. So this led to kind of rise in hate speech and ethnic tensions in social media. And some Buddhist nationalists, like Sinhalese Buddhist nationalists, took this as an opportunity to kind of for their opportunity, and they kind of blamed the Muslims for spreading the virus. There was one incident that took place. A 14-year-old Muslim boy, he was autistic, and he was beaten brutally by the police during the curfew because he was roaming on the streets. And he was autistic, but unfortunately, the legal authorities, the police, do not have any idea about the behavioral conditions or anything like that. So when he was referred to the judicial medical officer, this officer who examined the boy, he said that he has made disrespectful remarks about the minority Muslims, and he had actually blamed Muslims for spreading the virus. So racial profiling in Sri Lanka is very common like this, and this hate against Muslims is nothing new in the country. This has been happening for years and years. So especially after the end of the civil war in 2019, Sri Lanka's hate towards minorities, or kind of like the Sri Lanka's minority issues, took a new shape. While earlier it was towards the Hindus, the Tamil Hindus, but now it's towards the Muslims. And Sri Lankan Muslims have been stigmatized, they have been targeted with hate speech for years and years. And this kind of took like a very, this rose to peak after the Easter Sunday attacks in last year. So this is, and very recently after the lockdown. So right now we do not have any kind of lockdown. We are free to roam, but you have to wear a mask. And if you do not wear a mask, the police and the legal authorities can take any legal actions against you. So the masks are mandatory. So recently there have been, there's a bank called Sampath Bank in Sri Lanka, which is a private bank. So there was a Muslim lady, she was waiting online to enter the bank, and she was wearing her hijab, the headscarf, and she was wearing her mask. She was asked to remove her mask, and she was asked to remove her headscarf as well before entering the bank. This doesn't happen to anyone else. So this kind of, again, this again led to kind of like rise of hate speech. And so while we've been getting, if I talk about the right to information in the country, we've been getting daily updates, and we've been getting, about the coronavirus cases, what is happening right now, everything. But the media freedom in the country is actually questionable right now, especially under the current government. Especially when these governments, I think that these right now, our president was our prime minister is the ex-president back then, who actually kind of like, was celebrated for ending the war, but who also has human rights violation issues. So he was, so right now, the media freedom in the country is questionable, because under these people, these rulers back in the day, journalists were disappeared, they were murdered. So there is that. And last Sunday, the Sunday morning newspaper in Sri Lanka reported that the University of Sri Javardhanapura, who is actually a public university, they have been helping the government, their research center have been helping the government conduct PCR tests, but they pulled out of this collaboration because the government have been dismissing their positive COVID-19 test results as false positives. So this is something, and no one actually questioned the government, because everyone's kind of, there's no media freedom right now. This is something we have to talk about. And however, government noted that the reason it ended the collaboration with the University of Sri Javardhanapura's research center is because the state is now fully capable of doing it on their own. So this is the current situation. And if I talk about, so we are having our second wave right now, but there is no
Zinara, we have to one more minute to wrap.
Yeah, sure. Yeah, so we do not have any community spread right now, but there is fear about community spread, but the authorities have been telling that we manage the situation well. So hopefully we will do well there. So thanks so much. Yeah.
Great. We have a lot of inputs on the economy, which is a huge problem across the world. I mean, issues after issues of the magazines, newspapers, television channels. I mean, the economy is on a free fall across the world, across South Asia. And when it's going to stop, where it's going to stop is a big question that Zinara has asked. And media freedom, which many have mentioned, is coming back, Riaz. So now we are open for questions, right? So, and Riaz, is going to take care of that part. Riaz, are you there? Hello. We are going to have. Hello.
Yes. Yeah. I am there. Yeah. Nurullah, Nurullah Zardan, please stop presenting, or I'll have to remove you. This is the third time you are doing. Please stop it. So, Suvojit, you want to say something, summarize or something, or shall I take over?
No, you can take over. I think as many questions as we can have, it's better, I guess.
So before I open up for other audience, there are some senior colleagues and some journalists who have joined. Teresa Rahman is there for Assam, from Assam. Ghulam Jilani is there. He was our moderator yesterday. And some of my colleagues are there. Professor Devajyoti Chanda is there. Ghazala Yasmin is there. So you people, if you want to say something or have some question, you can start one by one maybe. Ghulam Jilani? Riju Basu was there, he left. Ghulam Jilani, are you there? Okay, so so anyone who wants to ask question, you can write your name there. So there are some questions.
Yeah, Riaz, can I just come in?
Yeah.
So I'm Ghazala Yasmin, and I just have a question for the women journalists. There's been a lot of discussion on how gender and gender related issues have kind of taken a backseat, and none of it is being reported in mainstream media, at least in India. So what can you just give a little bit of insight as to what is happening in your own individual countries in terms of reporting through a gender lens? Thank you.
Yeah. So Zinara, you can start first, and then a brief answer, and then followed by others.
You are on mute. Zinara, you are on mute.
So sorry about that. I didn't get the question correctly. Can you again repeat it briefly for me, if you don't mind?
Sure, Zinara. So my question is that, that a lot of issues of domestic violence and gender violence and gender abuse has happened, in terms of when we talk about the lockdown during the COVID situation. And not much of it has been reported in the mainstream media. So there's been, for example, in India, there's been, rise in child marriages and a lot of domestic abuse. So can you talk a little about, can you give us a little bit of an insight about, how, stories have been done in your own countries, where reporting through a gender lens has been missing or has been present, whatever has been the case in your situation?
It has actually, thank you so much for your question. It has actually been missing, there's not much reporting done about that aspect of the virus, how the coronavirus have been led to the rise of the gender, violence, especially domestic violence in the country. There have been a couple of articles written by local journalists about how the women in households have been targeted. They've been victims of the violence, the domestic violence happening every day. Especially there's something I want to tell. So I told that the government actually gave 5,000 rupees as an allowance. So this allowance was people to buy rations, groceries, for that immediate needs. But what the men in the households actually did was, especially in the rural villages and the urban low-income settlements, they took this allowance and so the governments actually closed down the bars, but they would just go, illegal establishment, and they would get alcohol. So they get drunk. Sri Lanka have a really bad drinking culture. The drinking culture is a huge problem in the country. So they would get drunk and they would come back home and they would start beating their daughters, they would start beating their children, the sons, the wives, everyone. So women have been targeted again and again in the households, and there have been very little reporting done about that. But however, we also have non-profit organizations like the Sambal Setting, which with professional psychologists and professional other experts. So they've been doing a great job about this. They've been reaching out to these women and helping women and helping them. So
we will go. Yeah, sorry to stop you there, because we have other speakers on that particular issue. Niha, if you'd like to speak briefly about that, on this coverage of women's issues, during COVID,
I think it's not reported
Hello.
Look at, so in pandemic, that so not something that is particular type, but
Niha, I think your voice is breaking, so maybe we'll.
Yeah.
go to the next one.
Yeah.
Then.
I see. It's breaking up. Yeah. So we can move on. We can. Sorry, Niha.
We'll come back to you again.
Zyma. We'll come back to you.
Yes.
We'll move to Zyma Islam. I mean, would you like to comment on that briefly? Because
Yes,
this is
absolutely.
question answer.
No, so when it comes to coverage on gender issues, it has absolutely gone down. The only thing that does get coverage right now are issues related to the pandemic. And that's not to say that the pandemic has not had an adverse effect on women and children. For example, child marriage has gone up during this pandemic because secondary school, like high school girl students are have dropped out. They no longer have access to education with schools being closed. They're not a part of the online education system. They don't have access to the internet, so they're not going to school anymore. And so child marriage has gone up. We don't have recent statistics for domestic violence, but the last survey that was done was in April. And what they found out is that the amount of women who reported being abused at their homes, half of them had never been abused before this pandemic. So that was very telling for us to sort of see how the pandemic has had an effect on women, on marriages, with women being locked up at home more than they usually would be, with salaries being cut, with men being out of job.
Right. Right. Thank you so much. Sumaira, would you like to comment briefly on that? Sumaira, can you hear us?
Yeah, I can hear you. Can you hear me?
Yeah.
I think
Go ahead.
Suvojit, I think unfortunately I have to agree on this point with my other female colleagues from different organization and different countries, obviously, but the region is, as you can see and as you can examine, that the region is particularly famous for this thing, that and we have this negative popularity. And even last year, when I was working on a UNFPA report, which was showing a staggering 32% of women, they were freshly included in the report recently, and that was even
Right.
Sumaira, you have muted yourself. Sumaira has muted herself.
So we go back to Niha, Masih, and just a quick comment from Niha on that, if we can hear her now.
Yeah, we can.
It's still breaking up.
Should I continue?
Yeah,
or you
I think.
are going to
Yeah.
another comment?
Go ahead.
If I think your voice is breaking, so we'll come back to you in like 1-2 minutes.
So,
like
Jit, should
in the
I
next round.
continue my comment, or you are going to another forum?
Yeah.
I just had a glance at here. So, okay.
Next.
Yeah. So I think her internet is slow, so voice is reaching her late. So Sumaira will come back to you in like 2 minutes. So please wait. Niha, you wanted to say something?
I'm fine if you want to go to the next question.
No, you continue and then we'll go back.
Okay.
I just want to make a brief point that gender
also gender reporting is not a top priority for a lot of media outlets, and that obviously gets exacerbated at a time like this. So it's not just about this particular time. And yes, there are specific issues that women at this time, which includes, of course, domestic violence and the rise cases, but also of job losses and what that means. So all of those things are also long-running trends that we have to keep an eye out for. But this actually brings us to the point of how much do we cover gender, even otherwise.
Okay.
Right.
So Gulam Jilani, are you there?
Yeah, I'm there.
Yeah. So go on with your
Am I
question.
audible?
Yes.
Am I audible? Yeah. Hi everyone, and thank you, Riyadh, and thank you other panelists for this wonderful session again. Yesterday also it was wonderful. So I have a question for Niha. I wanted to know one thing, because she represents Washington Post in Delhi, and we are local journalists here. So the government, as she mentioned in her earlier comments, she said that the government has not been forthcoming in sharing information. As every other person also mentioned, there has been a problem in sharing information. My question to Niha is particularly about how, because am I audible? I can hear some other voices. Hello?
Yeah, you go on.
Yeah,
I'm trying to mute others. You go on.
Niha, you have worked with the National Daily also, and now you are working with the international paper. So how is it different in terms of government's response to your questions? Because international media has been very critical of the government of the day earlier also, and this pandemic obviously. So how is the response different? Have you ever felt difference in response to international media as it is to the local media? That's my question.
Right. I mean, that's a slightly complicated question to answer, but I think the problem is that I have never been a beat journalist, so I have often faced that issue running into a wall with a particular ministry or a particular department of the government, because I don't cover that in and out every day. So I think my experience, even when I was working with NDTV or HT, was slightly different from other local reporters. But yeah, I do think that it's slightly more difficult for us sometimes, which can be for multiplicity of reasons, simply like having fewer sources and having to take the line. For instance, a newspaper does not use anonymous comments from officials unless in very, very specific circumstances are we allowed to do that. So with an Indian paper, it's not a problem. So if someone tells me ABC, I cannot carry that as a government response unless I have it officially, or unless I can state the specific reason why this information is not coming through. So I think that there's that issue as well. But yeah, I think that's unfortunately at this time, I think a lot of journalists are facing that, even national ones, because there is lack of trust.
Thank you. Sumaira, can you come now? You want to respond that women issue? Sumaira, please unmute yourself and then.
I think we can move ahead.
Yeah, I think we'll have to move. So there is some issue with Sumaira. So there are some questions I'm reading out. One Mr. Sanjay Saren, his question is directed to Zyma Islam. How are poor Adivasi people in Bangladesh making both ends meet during the pandemic? If you throw light on the matter, can you throw light on the matter? I'll read few.
Yes. Hi. Shall I speak? Shall I speak?
Yeah, you can speak.
Thank you. So I actually can talk a little about it, but I'm not going to say that I've done a lot of coverage on this issue during the pandemic. When it comes to the poor Adivasis, Adivasi, like the rest of the subcontinent, a large part of the community that has been, a large part of the population that was affected have been daily wage earners, and poor Adivasis make up the crux of the service industry in the capital. So, for example, the beauty parlors, they'll be serving at tables in restaurants. And with these industries coming down, people are not going to beauty parlors anymore to take services because of social distancing. I'm not going to say regulations, but social distancing, social norms. And so these daily wage earners have definitely faced massive job cuts. They are no longer being able to sustain themselves in the cities, and there has been a move back to some of the districts that these Adivasis originate from. Unfortunately, those districts have not been as hard hit as the capitals or the urban areas. But unfortunately, if you're an Adivasi living in a district bordering Myanmar, for example, the closest hospital containing an ICU bed will be, I want to say, 13 hours away from you. So they are, when they went back to their villages, they're also no longer having access to sort of health services that people from the urban areas are having. They don't have ICUs in those district hospitals. Those district hospitals are basically something very similar to rural health complexes at best. So while they've faced massive job cuts, they're also not getting the access to healthcare that the rest of us are. Is my answer.
Yeah, okay, thank you. There are more, because we are sitting in Bengal, so there are more questions on Bangladesh. What is the instantaneous situation of Bangladesh reporters or journalists to face the worst situation compared to other countries? And same question to Sri Lanka. Then there is another question. Maybe I'll read few questions and then you can take one by one. So there is one more question for Zyma. Don't you think that the current crisis has basically unmasked and shown us hostile side of international politics, especially in South Asian context, when some unnecessary tensions have raised? Maybe all of you can respond to this question. So these two questions, one by Sumaira message that there is a thunderstorm going on in Islamabad, and that is why there is some network lag. But I hope she is back now. So maybe we start with Sumaira because she is there, and then we go to Zyma. Yes, Sumaira, unmute yourself and then speak.
Have my option right now?
Yeah. So.
Yeah, I'm sorry for this little lag because there is a huge thunderstorm right now. We are bearing it right now in Islamabad. So I'm sorry for the delays, and please in advance I would say excuse my kids just roaming around in my background as well. So I would start with that previous question, or you want me to address to another question?
No,
can you please guide for that?
No, you can respond to both. The previous question on women and the current question is on how during the pandemic there has been this tensions and hostiles, like how issues which were kind of under the rug have come up, and now how, like in South Asia, we have different kind of tensions. So both question you can respond.
Yeah, I think regarding that women issue particularly, I think I'm privy to most alarming stats and figures right now in Pakistan. UNFPA is compiling its another report that will be like in open for. I think we just have to wait for another month for that. But even then, the staggering number of and stats regarding women, those who have been like falling prey to this domestic violence and child marriages, that was alarmingly on rise in Pakistan in last few years. And human trafficking comes as another very it's I think gigantically ignored element in Pakistan as well, with the kids who were being trafficked to these Middle Eastern countries. This is still under, I think, the much under discussed element right now, and much underreported issue because of few and significant pressures from the other countries as well. Those countries that we call them are so-called Islamic brotherly countries. So we will discuss that issue some other time if we have another forum like this for that. But right now, my female colleagues from different departments of media, because most of them are not working as field reporters, investigative reporters, and analysts on screen, but those who are part of media but they are behind the screen as producers, associate producers, camera persons, photojournalists, they have been hugely impacted because of this pandemic. Because when we go and think for these downsizing measures, then in our society we always prefer to and we prefer to lay off that female, because we always think that according to our media fraternity persons and elders, they always go for why they go for a male person, because they think that a head of the family, he is the breadwinner, so he should be on job, and we can lay off that women because she already has a husband working somewhere. So this is the advantage we are taking of women, and according to my according to data available from the country, just in Islamabad, 43 female colleagues have been laid off their portfolios as a media worker, as field reporter, as investigative reporter, and anchor persons as well. So this was alarming for me. And when it comes to the mentality of South Asian, please don't get offended with that term, but when we talk about men, the element is quite drastically different from the other parts of the world. Although I believe in that men are same everywhere, but in our part of the region, they blame everything. They put everything on pandemic. We are stressed out. We don't have jobs, and you are asking me for the fee of the kids, for the rent of the house. You are asking me every expenditure being made at house. So what kind of a wife I'm going to beat you for that? So this is not just my assumption. I have come across these examples, particularly in Pakistan, and few friends in India. They also share their experiences, and it's not just with that marginal sect of the society. Let me tell you, I'm not talking about just a woman representing a rural area, which in my country, rural area is of some 70%, and 30% under the urban area banners. So this is equally everywhere. It's the issue with the class women. It's the issue of with the farmer's wife.
There's
It's
some
the
noise.
issue with the laborer's wife right now.
Just a
And
second.
someone's mic
Just a
is
second, Sumaira. Just a second, Sumaira. Everyone, please mute your mic, or I'll have to remove you. Noor Zardan, I'm removing you because you again started the presentation. Go on. Yeah, Sumaira. Please be brief in your response. We are already like crossing the time.
I would be very grieved to tell you that the coronavirus crisis has deepened social inequalities in Pakistan, and it's with a very heavy heart that people have started realizing that if we are going to handle all these stress, and if a divorced daughter is also coming with her children and living with us, then a dead daughter is better than a divorced daughter with her kids. And we had seen many suicide attempts and suicides in various parts of Pakistan's rural areas, where a divorced woman is committing suicide along with her 3 kids, 4 kids, and 5 kids, because her parents were not ready to accept her in the crisis of pandemic, because they hardly had a bread to eat. So they could not be accepting her with acute social resources. So the tensions are obviously there, and once again, with heavy heart, they are going to deepen with every passing day. And that is why I think the Prime Minister took leverage of that situation, and when he announced this smart lockdown some few weeks ago on the eve of Eid al-Fitr, he said that it's better to have a dented economy instead of having no economy at all. So I have to lift this proper lockdown, and I have to implement smart lockdown just for the betterment of the labor set, as Zyma said. And I was really, I listened to Zyma's each and every word, and Neha, both were
Sumaira,
right.
please,
There
please
is
continue with your
an
response.
acute shortage
Yeah.
of authentic information coming from the government sectors. And Zyma, my heart goes out for those. So
Yeah, we have to
So,
move on.
so I'm wrapping up my note with that may this pandemic day start for everyone, especially for the labor economy,
Thank you.
okay, thank
especially
you.
for the sector of
Thank you.
laborers and those who are not earning much.
Acha,
Right.
can I suggest one thing, since I'm anyway reading the question, so all the speakers can open the chat box. There are some questions specifically to like some speakers, so you can just read the chat box while I ask my one question, so you can respond to 2-3 of them. I think most of the questions are directed to Zyma and to Zinara. So I have one question which is actually I'm asking it for everyone, to everyone. And that question is that, like, uh, I think Sumaira mentioned about Pakistan, about mask, and some other speakers also mentioned this pandemic, fighting with pandemic, because there is no cure as such, and vaccine is still not available. So the one cure which most people have suggested is precautions, and one of them is, and these precautions to what many politicians have said, we have to learn to live with the pandemic, and learn to live with the COVID-19, and that requires certain kind of behavioral changes. Like, say, in South Asia, we all are used to spitting everywhere, right? Or like putting mask, or say in countries like Afghanistan or parts of Pakistan, it's very normal to hug people when you meet, or like, say, in many, even Tajiks do, like even men do, but like, say, in Afghanistan, women generally kiss each other when they meet. uh, how these kind of behavioral changes where you maintain social distance, or like say in India, I see people wear mask but they don't put it properly, like the mouth is not covered properly. So how to deal with that kind of situation, like what kind of behavioral change uh, we see. I think Niha has to leave, so maybe Niha can start, and then others can come in, and meanwhile all of you can read the other questions also.
So the voice was breaking, Riaz.
Okay, so I was asking about the behavioral changes which we may need, like to fight this pandemic. Like, say, in certain part of our South Asia, there is this culture of hugging when you meet someone, or kissing each other, or like, say, in India, you must have noticed people put on mask but they don't cover it, their mouth properly. And there is also this problem, like especially in India, I can say, is that generally there is this sentiment among people that government is trying to impose these things. Like, it's not so much of awareness is not there about health issues. It's more like people see it as imposition, as some kind of punishment on them, that they have to live in house and they can't go out, and they are forced to wear masks. And how to deal with these kind of behavioral changes, like asking people in Europe to put on mask is quite easier, I guess, than, say, asking people in India.
Yes, you're right that asking people in Europe is question at all. It's not easy. Where a segment of feel wearing masks or so it's not a subcontinent issue. I think it's a larger issue about how people respond to these things, and I think we obviously face those challenges in India as well, but we are own. And some of that is obviously lack of awareness, because not everybody is exposed to all the information that we have sitting in our big cities, reading newspapers, or having access to information and data, particularly in the hinterland, and that's a challenge. And I think, for instance, even the simple thing about when people and there is ringtone as coronavirus, does this and you have to wear a mask. I think those kind of small things make that more acceptable so people don't react. And I think we have not done as bad as could have been. Obviously, there are times when people break these rules or don't follow them as well, but uh, uh, we see that there are also lots of people who are following that. And it also just stems down to the fact that we have to be open to this and also using the right kind of language. So it should not be that the government has ordered everyone to wear a mask, but that the government has asked people to wear a mask for their own safety. You frame it also, and similarly, when we say social distancing, I think physical distancing is a very aspect, because social distancing also can bring in class issues and so on. We have to be very careful of things and to make sure that while we are trying to make people aware of this or implement this, we are not creating further divisions based on caste, class, religion as well, as we know that those divisions exist in society in particular. So so behavioral change is not easy, it is not overnight, and it is but yeah, how else to do this besides making this as a rule. Yeah.
Thank you.
So
other ones to Nurgul Shafaq, are you there? So maybe we can give Zyma. Maybe we can give Zyma.
Yeah, I am here. Yeah.
Okay, Nurgul. So I was asking about behavioral change. Can you speak on that? And then we'll go to Zyma and Sumaira for the.
Yeah, why not? Like some other Asian countries, you know that guests from different part of, I mean relatives, they come to others' home. So in Afghanistan also, when somebody ill and if she is in the village, they come to big cities like Kabul. So one change that I am aware of is that nowadays people are not going each other's home. Like you know, Pathans are very famous in Mehman Nawazi. So they are now very clear about the virus and not going too much to each other's home. And the second thing, as you mentioned, that here in Afghanistan, the male are hugging each other when they meet, and women are kissing each other. But now it seems a bit different, and like they, I mean, some of them are. When they are meeting, so they from far they are doing hi hello to each other, but most of people are still don't care about that. And the second thing is, if before the corona pandemic, if someone was buying fruits from the city, if they were washing them for one time, now they are washing it for 2 to 3 times. And in Afghanistan, like we are living in big families, even there are some families, they are more than 50 members. And in each room, there are living some 8 to 5, even to 10 people. But because of the pandemic, I hear about hear from some of my friends. They have bought some tents and they are living in tents to avoid the spread of the virus. So these are some changes that I know about.
Okay, so there are some questions directed to Zyma and to Zinara. While you respond to that, I also want both Zinara and Phanindra to respond to this question. Is considerably Nepal and Sri Lanka, although their economy is also largely based on tourism. That means more number of people from outside coming, but they have sort of been able to control it, like done quite reasonably, quite well compared to say India. Which has crossed over 1 million already. So if you could, like, what was these early decisions which helped them control it? If you could just briefly mention that, while you maybe Phanindra can respond, while Zyma and Zinara can read questions and be ready, and then we can give both of them 5 minutes and then wrap up. We are all.
Yeah, and just to add to that question is, Maldives has opened the country to the tourists. So do you see anything, something of that sort going to happen in your countries, Nepal and Sri Lanka? Thank you.
I think when the first case of COVID in Nepal was reported in January, the case was reported after the man who came from Wuhan had already recovered from the illness. And then it took till March and before the second case was discovered. And Nepal had huge plans this year. It had launched Visit Nepal year and was aiming to attract at least 2 million tourists in the country. And even the tourism minister was playing down, saying that Nepal is a corona-free country and it is welcome and open for business and visitors are heartily welcome. And that was the scenario. And there were some sections who were very critical about his remarks, and he faced a lot of censure for trying to take the matter lightly. And so when the second case was reported around March, in March, Nepal imposed lockdown like the one in India, which helped the pandemic to spread. But still, because the borders, Nepal share open border with India, and a huge number of workers who live in India, they returned back home. Cases started to emerge, and there were no many lab facilities. There were no proper testing available in the countryside. The cases began rising. Things were, I think, in a good shape for some time, but because of lack of resources, and as Nepal took steps to expand laboratories and things like that, it took many cases were not reported, though the cases were already there, and we still in fact don't know the real scale, because as I mentioned, currently the number of cases that are tested are around 3,000, 4,000 these days. But at some point in the previous weeks, the government officials said they were conducting up to 10,000 tests per day. And about tourism, I think tourism contributes to nearly 5% of Nepal's GDP, and a huge section of people who are dependent on tourism are in a very difficult state. The mountaineering season was completely closed this spring, and we don't know what will happen for months. And the government also doesn't have any concrete plans, and the entrepreneurs and resort owners, they are urging the government to come up with a relief package, because new 5-star hotels and this kind of new infrastructures were developed in the country given that the country was marking this year as Visit Nepal year. So it is a huge blow on Nepal's tourism, and it may take few years to recover.
Yeah.
Thank you.
So Zinara can talk about that a bit.
Zinara, you are mute.
You're mute. Yeah.
Sorry about that. So like Phanindra told, we also had our first case in January 27th, which was a Chinese tourist from China, returned from Hubei. And before that, the government followed actually the developments happening around the world, and they had established a screening center, COVID-19 unit at the Colombo airport. So by the time this people were screened, their information were gathered, so everything was happening. So this is one step government took. And other than that, following the second case in the country on March 10th, which was a local tourist guide, Sri Lanka suspended all the travel visas by March 11th. So they restricted tourism. So as I told you, the tourism is all like absolutely nothing now. Like it's zero. It's all suspended. And there is no tourism happening now, but our tourism was hit way before the pandemic. Like I told you, the Easter Sunday attacks. So, like Phanindra told, like a lot of people were, however, like very hopeful by November and December last year that the tourism will slowly pick up and they would invest on certain tourist infrastructure, like new hotels, new restaurants, and all those things. And some people will go on organizing these tours and everything because they were hopeful that people would come here. So that has been greatly affected, and I think it's going to take time to recover. Sri Lanka was supposed to open on August 1st for tourism, but under very restricted guidelines. There were guidelines like you have to have a COVID negative test prior to 3 days prior to your travel, and once you come here, you have to be tested, and you can only stay with like 4-star, 5-star government recommended establishments. So, however, this has been postponed now, so we are not opening on August 1st. I think even the Maldives, like Sujit told that Maldives will be opening, but they also have right now like a very restricted guidelines. Like you can only stay at certain luxurious accommodations only, and you cannot go to homestays or stay there. So this is going to take, I think, probably 2 to 3 years to recover. Yeah, I think I have a couple of questions. Can I answer to those as well?
Yeah.
So,
you answer to those, and then we go to Zyma.
Something that I got was that will the Indian travelers will they be affected in the future? Will their travels to Sri Lanka will be affected in the future following the developments? I do not think so, because absolutely, like Sri Lanka as a country welcomes all kind of travelers. Even before the pandemic, that we had like a very easy visa procedure for pretty much all the nationalities, and that is I mean, Indian travelers are a part, they are a big sector of our travel industry, so there won't be anything like that. And someone I think asked about how the female migrant workers, how have they been treated? A lot of our women, they work in the Middle East as laborers, as domestic workers. And this has been a tragic situation, actually. Like Sri Lanka actually sent a lot of rescue flights, the national carrier Sri Lankan Airlines. They initially sent a lot of rescue flights to get back the Sri Lankan students from certain countries. They have also sent a certain number of flights to the Middle East, but a lot of Sri Lankans are still stuck in Middle East. And the physical conditions, the living conditions in the Middle East for low-income laborers are it's not in a positive condition. So some women have been actually they've been posting on social media from their working countries saying, pleading the government that please get us back. Some women are like, I'm pregnant right now, and we do not have a very good conditions here, and we will pay for our quarantine facilities and all those things. So and actually the government suspended rescue flights last week and for another 3 weeks. So we have not been sending in rescue flights right now. So that is one thing. So there's been a lot of challenges related to female migrant workers. Yeah, that's my answer to those. Yeah.
May I just will come to Zyma, but just I want to add one thing. I mean that the Indian tourists going to Sri Lanka, or Indian tourists going elsewhere. See, the problem, what I understand now, if you look at the Indian internal tourism, which is quite huge, like Bengalis travel to Kashmir every Durga Puja. During this festival time, they go in large numbers to particularly Kashmir. Now, what is the situation in Kashmir, for example? I mean, it has been under lockdown for just not 4 months, but 1 year since the special status was removed in Kashmir. So the tourism, when I last went there, that was in October, November, the tourism was over. I mean, people who were into tourism, they were changing their jobs and changing their business, changing their profession. India, the livelihood, I'm sure that is true for South Asia. Livelihood is getting changed. You know, people are moving from one job, like the drivers are moving into selling, you know, subsidies, the vegetables, things like that happening. So people from tourism moving to other sectors. So if the tourists within the country cannot travel to their own country, because the economy, as I said, is still on a contraction mode, and it is going to be on a contraction mode for, well, 6 months to 1 year, maybe till the end of 2021. So if that is the situation, then how they're going to travel? Because you travel with surplus capital, it's surplus money, which is at this point not there. It is just not there. People are losing. It is still contracting. So first thing is survival. Then it's a question of revival, maybe after a year. And then it's a question of growth. So when you go to that growth bracket, which is the third phase from 1 year from now, maybe 1.5 years from now, then only we can think of tourism. Till then, tourism is a sector which is going to suffer, I think, like all other sectors, in a big way. So that is my take on the situation. Maybe we can talk more about it. Maybe we can have a webinar on tourism and economy later. We go to Zyma now for her comments.
So Zyma, while you start, there is like one issue which you missed and which we also missed. One of the student has asked is the situation in the Rohingya camps. So maybe you can begin with that and then take other questions.
Absolutely. I think almost all the questions, I think there were like a total of 3 questions. One was on the international relations between Bangladesh and other countries. Another one was on the Rohingyas and what situation they are at right now. The last one was on the effect of COVID-19 on journalists. I think I've talked a bit about the effect of COVID-19 on journalists in Bangladesh, so maybe I'll attend to the other 2 first. Both the questions are actually related in a way. So, I mean, if, for example, when the pandemic first started, there was a huge fear that the pandemic could literally be like a virus bomb in the Rohingya camps. Interestingly, that fear did not come true because of how well maintained these camps are. These camps are under the direct supervision of international NGOs. So in many ways, the social distancing measures, public awareness campaigns, and then the camps were supplied with necessary sanitation products, hand washing stations. So the infection rate in the camps are actually a lot less than the rest of the population, rest of the Bangladeshi population. However, up until June, the Rohingya population did not have access to a single ICU bed. It was only in June, on World Refugee Day, that UNHCR installed an ICU in the district hospital, and now Rohingya refugees who require a more intensive medical care can access them. But up until that point, they were actually barred from, because here's the thing, Rohingya refugees cannot leave their camps. There are actually checkpoints in place that keep this entire large group of people on a certain specific plot of land. And not only is that a violation of their rights, it also restricts them their access to health services, restrict their access to education services. So the only services that they get are what UNHCR provides them, or what these INGOs provide them. And therefore, that rule was sort of relaxed in June, and an ICU was set up, and they were allowed access to intensive health care. But that was only in like late June. So the issue of repatriation once again cropped up when the pandemic started, because people were like, we have this virus bomb in the southern part of Bangladesh. They should be leaving. They should be going back to Myanmar, because the host community was especially very, very averse to the idea of a concentrated group of people living in close proximity to them when a pandemic was going on, and it was definitely bordering on racism. The sort of I guess, attitudes that people were showing towards Rohingyas. We were always racist towards Rohingyas. From the minute that they came in as refugees, Rohingya has become a slur. Rohingya is how Bangladeshis call people who may be underperforming. I mean, Rohingya has just become a slur right now at this point. So the pandemic definitely exacerbated like racist attitudes towards them. And the repatriation once again popped up as an issue. When it comes to other international relations, I think one of the biggest problems that we've had has been with countries deporting our migrant workers back to Bangladesh. So remittance is right now the highest contributor to the GDP of Bangladesh. That just to tell you of like how many migrant workers we have all over the globe, especially in the Middle East. And what happened is that when these migrant workers are now being deported, because many of them are losing jobs. The minute you lose a job, you also lose your visa. You can no longer stay there, and that has become a huge issue for the country, because Bangladesh has had to arrange for these migrant workers to come back to Bangladesh. I mean, Bangladesh has had to pay for it. This has we've brought back thousands or tens of thousands of migrant workers on special charter flights by now, and it's been very interesting that our country has actually been taking sort of a back seat when it comes to negotiating with the countries employing these migrant workers. Our country is acting as if, I mean, of course, we have a lot more to lose, but our country is not advocating for the rights of the workers, not advocating for the rights of the workers to stay there, to actively seek other jobs. For example, in Malaysia, there was an Al Jazeera documentary where Bangladeshi migrant workers were interviewed regarding the kinds of conditions that they stayed in Malaysia. They stay in like abhorrent conditions in dormitories where like people are stacked up like sardines in a can. And this one Bangladeshi migrant worker spoke up, and then the Malaysian authorities started a witch hunt against that Bangladeshi migrant worker. They canceled his work permit, and Bangladesh didn't say a word. Our foreign ministry was not only completely silent, they actually actively supported the Malaysian government into doing that. That is essentially an infringement of the right of a person to have freedom of expression. You can talk to Al Jazeera or whoever you want about what living conditions you are in. It's not crime. But because of that reason, Bangladesh has definitely taken a backseat. We've also had issues with similar issues with migrant workers being abused in Vietnam, in Maldives, and Bangladesh has done nothing in those cases, in hopes that our migrant workers, that we won't lose those employment markets in the future when this pandemic ends. And of course, the workers are to blame. For example, just before I started this webinar, I filed a story about like how 219 prisoners sent back from Kuwait, Qatar, and Bahrain. They were prisoners because they were mostly undocumented, and some of them were imprisoned on petty drug charges. I literally just filed a story on like how the minute their quarantine was over in Bangladesh, they were sent back to jail in Bangladesh. They were undocumented in the Middle East. They're not undocumented here. Like that's a crime in the Middle East, even though it shouldn't be a crime. But the minute their quarantine was over, they were just locked up by Bangladesh because the charge is very vague. The charge is for tarnishing the image of the country and ruining prospects of future employment. Like it's such a vague charge. It doesn't even make sense. So that's where we stand in the international labor market. With India, we've had some specific issues. So, for example, right now, one of the biggest issues is that and I mean this is a 3-decade-long war over waters. But we share a transnational river called the Tista, and Tista begins at Sikkim and it ends in Bangladesh, and over 1 million people in Bangladesh are currently flooded. And the thing is, Tista flows into one of the most poorest regions in Bangladesh. So these are all fishermen. These are some of the people who have been the hardest hit by the pandemic. They have gone below the poverty level. And so when the Tista barrage, the Tista has, I think, 4 dams from the length of Sikkim till the point where it reaches Bangladesh. I think it's 4 or it could be more. I don't recall correctly. And the dams have been opened, and the waters are right now 1 million people are inundated. Their homes have been flooded, and because of how strained resources are, relief is not reaching them. So I mean, that's always been a problem, transnational sharing of waters, but this year the pandemic sort of added a new dimension to that, definitely. And lastly, there are around 1.5 lakh foreign nationals in Bangladesh, which includes Indian citizens. My grandfather's brother and his wife, they've been stuck in Bangladesh since February, since March, actually. They're Indian nationals. Half of my family is from India. So they're Indian nationals. So they've been stuck in Bangladesh since March because the Indian government has made no efforts in repatriating Indian citizens who are stuck in Bangladesh. Our borders are very porous. They usually come for tourism. Most of us, because of the way partition played out, most of us have like family on either side of the border, and with this West Bengal especially, it's very normal to have tourists from West Bengal coming to visit family. And there has been no attempt made to repatriate most of these people. There were like 2 flights, I think. There were just 2 flights. One going to Delhi, one going to Kolkata, that carried, I forget how many people. But I think that's how much I have on international relations in view of the pandemic. Is there anything else, Riaz?
No, I think so.
I would like to add one sentence to what Zyma has said, that we have not discussed the biggest elephant in the room, which is China. China has been shaping and reshaping the definition and history of South Asia. Well, good or bad, we don't know. But the point is, this is very interesting, that perhaps the biggest issue between India and Bangladesh now comes in the form of China. I mean, how
also India and Nepal. Also India and Nepal.
I mean, that's why I said the biggest elephant in the room: India, Nepal, India, Bhutan. I mean, India's foreign policy, I think, is getting redefined on the basis of firstly, its domestic policies. It has a huge focus on its elections, and as a result, its foreign policy, somehow they could not tie this domestic policy and foreign policy together, which is affecting on Rohingya issue, to all the issues Zyma has mentioned, to the doctors from China going to Bangladesh. There is this border issue, Petrapol, Benapol. There's so many. I mean, and everywhere we hear about China. Now that is very interesting. Perhaps we should have one more conversation on that, focusing on China in South Asia. And I'm sure the journalists are going to Riyaz can help us on that. Yeah, Riyaz, go ahead. Yeah.
If you are willing to chair, surely we can have.
I'm very interested. I mean, on China, we can. I have been visiting China many times. I mean, over the last 6 years, I'm in Calcutta. And I find it a very fascinating country. And there are many things to say about China, which I'm sure we will do over the next 6 months. At least we have to do a few more webinars, I'm sure. I think this is very encouraging. I mean, the response that we are getting. And I think, you go ahead. I mean, you were saying something. Yeah.
No, I was not actually saying that. So we are almost 3 hours. So if we have your permission, we can maybe just wind up. Do you want to say some concluding word, or we go?
Just one small. I mean, what I said already, that we are looking. It's a long haul now. What it seems that it's not going to end there. Post this pandemic, this pandemic, that health-driven pandemic, virus-driven pandemic, we are going to have an economic pandemic. If we survive this, how are we going to survive that is a very fundamental question. And we're going to take up that challenge, discuss more solutions. And the journalists are better people. I mean, the best people to do that. Here we have done today what Aliah has done and you have done. We have broken the borders. We have spoken about our country. We have spoken about each other. And that is the solution, to look at South Asia as perhaps one unit, and talk among us. I mean, I'm not saying bypassing one's own country, but keeping our own country with us, we can talk about each other's issues, because till we do that, I think at least we cannot highlight very fundamental issues like, what is going on. I mean, and this kind of situations always lead to conflicts. when you have a crisis of resources, you automatically go towards a conflict. So how do we avoid the conflict, cooperate, collaborate, and survive, over next 1 year to 2 years maybe? That is a fundamental question, and we're going to discuss. I'm sure we're going to discuss more and more on that. This is a good start. Thank you very much. With that, I kind of, that's it from me.
Thank you. So before I wrap up, Phanindra, do you want to come in and say a few words, like 1 minute?
Yeah.
1 minute, you want to say something?
Or Ghulam Jilani wants to speak a little?
Ghulam Jilani or Phanindra?
Yeah, I'm sorry I couldn't attend the whole session because it was my working day today. Friday was my off, so I was free yesterday. But yes, it was very good. Like, thanks to Riaz Bhai and his university, and thanks to Sujot sir, to you. It's been, it's a different experience to talk to people from other countries, especially on a point that binds us all in current times. And the more important thing that Sujot just said is how to deal with pandemic that comes post-COVID, like how to deal with this post-COVID situation, be it job losses in media and any other industry, be it economy, be it the health crisis, because all these countries like Bangladesh, like India, like Nepal, the common denominator is we have a poor health infrastructure, and that was exposed by this pandemic. And I don't know, I don't see, unless some miracle happens, I don't see virus going anytime soon. But let's hope for the better, and let's see how things shape up in future. Let's hope we have a better future. Thank you so much. That's it. Thank you so much.
Phanindra, 1 minute.
I think this is a great conversation, and we talked about like one of the biggest crises that humanity is facing, and we don't know like how the situation will end, but because we share a lot of common things in South Asia, despite that we are less integrated kind of region. It provides this conversation provides an opportunity to listen each other and also know about things and where we stand, we can do together. I really benefited from the discussion. I would like to thank you for this initiative, and let's continue the dialogue and find some.
Zinara wants to add a line.
No, all the speakers, one minute maximum.
Yeah.
It's been a great session and a great discussion, and thank you so much for making me part of this discussion. And I think, like Sujit said, like it, may got us all together to discuss about the issues happening and what we should do post a pandemic, and that's going to be a huge crisis, more than right now what we are facing. And also, if I want to add a suggestion, maybe for future webinars, if you're going to have anything, I think we should, I do not represent Northeast India, but that is some part that I've been traveling lately. Before the pandemic, I've been traveling there extensively. And I think Northeast India during the pandemic would be a good good thing to discuss about, because the people have been stigmatized, but also right now, Assam is experiencing severe floods, and thousands of people have been displaced without access to rations or food or anything. And all this is happening in a pandemic. And I think the national media in India have been largely silent about this issue, and it's been largely unreported. So that is something we could discuss about in the future. And it would be really great to have maybe some journalists from Northeast India, because they've been always like, we never hear their voices much. So that would be something really great. I would love to see that, something like that. And thanks so much for having this conversation. Thank you.
Right.
Thank
I
you.
think Sumaira and Niha is
left. Nurgul, Shafaq, you want to say something? 1 minute. Nurgul, Shafaq, are you there?
Yeah, I just want to say thank you.
No, other than thank you. Everyone has other than thank you, if you want to say something.
Oh, okay. So,
I was very interested. I was very interested to hear more about. Sorry, I was just very interested to hear about this Taliban, being released from prison, for the job. So, but later, yes, but later we can talk. We can talk privately.
Okay. So just one thing that was left. Because of corona pandemic in Afghanistan, journalist was still they are very in bad position. Like NIA, an agency, it's supporting media in Afghanistan. They have announced some hundreds of journalists who are affected from the pandemic, and some 6 of journalists are died because of corona, and those journalists who are covering especially corona related issues. And also, as some other friends mentioned, Afghanistan is affected in business sector also. So, and again, thank you that you provide me this opportunity to share what is happening in Afghanistan and hear others what is happening in their countries. So it was a good experience.
I now invite Madhubanti Mitra. She is assistant professor at IELTS and PhD scholar at Aliah University to give the formal vote of thanks. Madhubanti? Yeah,
yes, sir. Am I audible?
Yeah, go on.
Thank you, Riyaz sir, for this wonderful introduction. So this was an amazing session indeed. The theme of the discussion being the extension of what we discussed yesterday. This session kind of educated us about the situations that people are facing during the COVID-19 outbreak all over the Southeast Asia. So we also heard about the challenges of most of the journalists of Southeast Asia that they're facing, and we touched upon human interest stories, health aspects, socio-political aspects, and other important sides of this pandemic in respect to 6 Southeast Asian countries, right? So I would like to offer my heartfelt gratitude to Mr. Suvojit Bagchi, who's chaired our session today with utmost adroitness, I must say. He's been directing the conversations in the perfect direction and, been on the clock exactly what is needed for an enriching webinar like this, right? Thank you so much, sir, for your valuable contribution. So going forward, I would like to thank our panelists, Mr. Noor Gul Shafaq from Afghanistan, Ms. Sumaira Khan from Pakistan, Ms. Niha Masih from India. I think they have left already. Mr. Phanindra Dahal from Nepal, Ms. Zyma from Bangladesh, and Ms. Zinara Rathnayake from Sri Lanka for your great insights, enriching discussions, and presenting the current situation of your respective countries in such a holistic manner. And I would like to thank all of our participants, including Jilani sir, the chairperson from our webinar from the last Eve, for coming here on both the days, and we hit a number of 100 participants on both the days, and that's commendable considering how Riyaz sir opened the session saying that people are becoming wary of webinars. So thanks to all of you for your enthusiastic participation today. And last but not the least, I would like to thank Riyaz sir for organizing something so unique and enriching, and for braving webinars of such huge scale for 2 days at a stretch, considering you've been sitting there muting and unmuting people, letting participants in constantly, and keeping a tab on everything that has been happening together with so much dexterity. So thank you everyone for making this a success together. That's all from my side.
Thank you, everyone. So you can all log out. I'll stop the conversation.
Right.
Thank you.
Thank you. Bye.
Bye.
Bye-bye.